Hello, my name is Juan Patricio Valderas from Universidad de Antofagasta of Chile, and my abstract is SGLT2 inhibitors efficacy in type 2 diabetes patients with bariatric surgery. The bariatric surgery is a part of the treatment of type 2 diabetes around the world in patients with obesity, even is included in the international recommendation. But a great percentage of these patients undergo hyperglycemia after the procedures and require antidiabetic drugs. However, the same algorithm employed with non-operative diabetic subjects is used with these patients. However, the anatomical and physiological changes produced by bariatric surgery could affect the efficacy of the drugs as well as increase the adverse effects. The SGLT2 inhibitors are new antidiabetic drugs with positive effects on body weight, blood pressure, cardiovascular events, and nephropathy. Then the aim of our study was to evaluate the efficacy of these drugs in type 2 diabetic patients with bariatric surgery. This is a retrospective case series of 17 diabetic patients with bariatric surgery from 3 Chilean centers. And we report the changes in HbA1c and weight before and after 6 months of the use of these drugs, as well as the main adverse effects. We can see in this table the baseline characteristics of the patient. Name were female, the age was 54 years old, BMI was 27 with 0.6 kilograms. BMI, and the weight was 73.3 kilograms. 11 patients had a gastric bypass and 6 and a sleeve gastrectomy. Months since surgery was 27 months. This is the median. The range was 6 months to 72 months. The HbA1c, mean HbA1c was 7.9. 15 of the 17 patients were on antidiabetic treatment, 14 with metformin, 1 with DPP-4 inhibitors, and 8 with insulin. After the 6 months, the HbA1c was reduced in 0.9%. The confidence interval was 0.6 to 1.1, and very significant. And the body weight decreased 0.7 kilograms from 0.7 to 2.9, and was significant too. 2 patients suspended insulin. 1 patient had a mycotic balanitis that responds to topical treatment without withdraw the treatment, while an HR patient underwent a severe vulvovaginitis, and stopped the drugs at the 2 weeks. Therefore, she was not included in this report. No other adverse effects were observed: cetoacidosis, hypotension, falls, fractures, no one. Then, in our cohort of type 2 diabetic patients with bariatric surgery, the SGLT2 inhibitors preserved the hypoglycemic effects, and it was similar than published in non-operative subjects, near to 1 point. Okay? A small but significant weight loss was also observed. This is important because the most of these patients are in the process of regain weight after the surgery. Okay? The genital infection was the only adverse effect observed, but it can induce the withdrawal of the treatment. Then, this drug could be a good alternative in the management of hyperglycemia in bariatric surgery, but more studies are needed to develop an specialized pharmacological algorithm for bariatric patients. Thank you.
Thank you. So it's open for questions now. Go ahead. You can keep it. It's okay.